Okay, welcome to ventilatory management skills. These progressive skills are designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-traumatic situation and cervical precautions are not necessary. You're required to demonstrate sequentially all procedures you would perform, from simple maneuvers and adjuncts to endotracheal intubation. You'll have 3 attempts to successfully intubate the mannequin. You must ventilate the mannequin for at least 30 seconds with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout these skills. I will correctly carry out your orders upon direction. Do you have any questions?
No, sir.
At this time, please take a couple of minutes to prepare your equipment, check your equipment, and prepare whatever you feel is necessary. When you are ready, let me know that you're prepared and we'll begin.
I'm ready.
Okay. On your arrival to the scene, you observe a patient as he or she goes into respiratory arrest and becomes unresponsive. A palpable carotid pulse is still present and bystander ventilations have not been initiated. The scene is safe and no other hemorrhage or other immediate problems are found.
BSI?
Yep.
Good. Come up to the patient, open the airway with a head tilt chin lift, insert an OPA, correctly sized from tip of the earlobe to the corner of the mouth. Begin ventilating the patient at 10 to 12 breaths per minute.
All right. Stats are 85%.
Okay, at this point, I will attach oxygen at 15 liters a minute, along with bagging the patient.
Okay, time start. All right, you've been directed to intubate.
At this point, I would have my assistant bag the patient continually at 10 to 12 breaths a minute to pre-oxygenate. And while he is doing that, I will be checking my equipment. On my endotracheal tube, I'll inflate the cuff, making sure there are no leaks. No leaks present. Checking my laryngoscope, making sure the light is white and bright. Once that equipment is set up, I will give my assistant the order for last breath. Reposition the head, sweep the tongue, visualize the vocal cords, insert tube to the desired depth, the second black line, 21 of the teeth, inflate the cuff, pull out the stylet, and ventilate the patient. As we're ventilating the patient, we will check with the stethoscope, check over the epigastrium, left lung, and right lung.
All right, what are some other ways you can make sure that your tube is correctly placed?
To hear clear and equal breath sounds bilaterally with end-tidal capnography on the end of the tube.
All right.
At this point, I will secure the tube, making sure I do not let go. Tube is secure.
All right, you hear gurgling sounds in the tube.
Okay, at this point I will continue to ask my assistant to ventilate the patient. I'm going to turn on suction, selecting the appropriate size suction catheter, measure from the sternal notch the tip of the earlobe, the tip of the tube. Once I have that measurement, hold it between my thumb and my forefinger, and have my desired depth. At this point, I will say last breath, insert catheter all the way to the desired depth, and begin suctioning, rotating as I come out. No more than 10 to 15 seconds. Once that is done, direct my partner to ventilate while I'll clean the suction. Turn off suction, and at this point, I will monitor breath sounds, vital signs, and end-tidal capnography, and pulse oximetry.